All right, welcome back to the Healing Wellness Show, where we cut through the noise and talk about real solutions to help you feel, look, and live better. I'm Dr. Karim here, and today we're just going to dive down into a powerful conversation that's not just about weight loss. We're going to explore how medical grade tools like GLP-1 medications, red light therapy, infrared sauna, hormone support, gut health optimization, so lots of different things. And that's how we can help you lose weight sustainably, balance your hormones, and feel better from the inside out. But here's the catch. There is no one size fits all solution. That's why everything we do is personalized. Every patient that starts with a doctor supervised consultation, and today we're giving that consultation away. And that's to our listeners for free. So stay with me. This episode could be the start of your breakthrough. So what I have here is I have Mark. He's going to be asking me questions as they come along from our viewers. Mark, if you want to introduce yourself and let's get it going.
Yes, thank you so much, Dr. Karim. It's a pleasure to be here today. And again, my name is Mark Anthony Stevens. And today we're going to be asking questions, what people want to know. There's a lot of people out there in social media land that have a lot of questions and they're not being answered. And the great thing about Dr. Karim is he's going to be answering questions that maybe sometimes people don't want to answer because they just want you to call in. But the beautiful thing is you can actually listen to it today and also call the phone number on the screen if you have any questions or if you'd like to get a consultation. So today, the first section of questions that we're seeing is about weight loss. So we can kind of start there. One of the biggest things that we're seeing with one of the big questions is why are so many people frustrated with dieting?
Well, it's because there's so many diets out there. Okay. There's so many fads out there. And a lot of times they just don't work long term. And most of them focus on whether it's calorie restrictions or focus on certain foods, but they ignore a lot of things like hormones, the gut health, which is the most important thing that we really see in a lot of these patients, inflammation, another big one, and mental. So the approach that we usually go for, it's not the quick fix, really. It's restoring the balance, removing the blocks. It's helping the body want to lose the weight. And that's by figuring out really what's the core problem so we can go after that.
Awesome. Another great question is I'm seeing people ask is I'll lose the weight, but then I gain it right back. Why is that?
Yeah, we get that all the time. It's like, hey doc, I've tried A through Z diets out there and I will start losing weight, but then when I stop, I gain it. Or hey, I start to lose weight and then I plateau and I can't lose anymore. That's really a huge gut health problem. That's what we call a leaky gut syndrome a lot of times. I would say 80% of patients that come in, that's what they have. No one's ever addressed the gut flora or addressed the leaky gut. So we do have protocols, we do have testing that we kind of look at that and then create a program. And typically when they start doing the gut health, that they're really start losing 10 to 15 pounds a month. But we don't really use it as I don't call it weight loss. I call it a gut cleanse. Best way to explain is think of your gut as your second brain. That's where 80% of diseases come from. That's where inflammation comes from. I mean, there's a lot of known diseases that come from the gut, like type 2 diabetes, thyroid problems, Crohn's disease, ulcerative colitis, some autoimmune, fibromyalgia, lots of different ones that are known that come from the gut. So that's why we got to clean the gut, seal the gut, remove the bad bacteria, and then introduce the good bacteria back in. That's really the gist of it.
Okay, awesome. Thank you for answering that question. We have Sally from Texas. She's asking, could my hormones be preventing weight loss for myself?
Yes, hormones is another big one. That's why we do a lot of blood testing, because if your hormones are off, then it could affect your weight. It could affect your mood. For hormones, we got to test lots of things because they're the gatekeepers to your metabolism. It could be a thyroid problem because now you're sluggish, or cortisol is too high, or your body isn't burning efficiency. When we're testing, we're also going to be testing estrogen, progesterone, testosterone, because usually men and women over 35, those are also affected. So there's lots of things that need to be checked to see, well, are those optimized? Well, if those are optimized, then it's not hormones. It might be something else. And that's why we kind of sit with you and dig in deep to figure out what the root cause is.
Awesome. Awesome. We have another question from John from Mississippi. He's saying, I'm eating right, I'm working out and staying away from the sugars. But one thing that I think that might be allowing me or is allowing me to keep my weight on is stress. I'm stressing a lot, a lot of family problems. Could stress be a big factor to what I'm going through and not losing weight, even though I'm doing all the right things?
Absolutely. If you're not getting enough sleep because you're stressed or just stressed at work or stressed at the home, that also does affect, your hormones. So that does play a factor. So that's why, a lot of times we'll say, well, what's the stress? What is causing that stress? So we're trying to dig deep and see what is really the cause. Is it something that happens that causing you stress, or is it work? Well, is there something that we can, have you start working on to reduce that stress? Or when you start to notice it, let's start doing something else to get your mind off of that or to decrease that stress.
Awesome. We have Peggy here. She's asking, how long should it take to see results when we start working with your protocol?
Really, as long as you're following exactly what we're telling you to do, like I said, you'll start seeing that within 2 to 3 weeks. You'll start to see differences in your body, in your energy, in your mood. And then, like I said, our average loss in weight is about 10 to 15 pounds a month, depending if you're a male or female, and depending on how much weight you're needing to get off.
Awesome. I don't have a name here, but I do have a question, Dr. Mo. Somebody says, do I have to cut out carbs completely?
That's a very good question. No, your brain actually needs carbs, but you need to feed it good carbs. I always say there's bad carbs and good carbs. So bad carbs are going to be like your like white heavy pastas, your white starchy potatoes, your heavy breads, those are carbs are kind of heavy on the body. Your body isn't able to break it completely down. So then it starts to convert it into sugar, and then it starts to store it as fat. Good carbs are going to be like your vegetables are actually carbs, your fruits are carbs. Really good source of carb would be like sweet potato, quinoa, wild rice, millet. Those are really good sources of carbs that your body's able to break down pretty quick and optimize.
Great question. We have Julie. One of her questions is, should I be drinking a certain amount of water while I'm losing weight, or does it really matter? Or is water going to be more water weight where it's going to be hard for me to lose weight?
No, water is very, very important. Research out there is saying you should be drinking about half of your body weight in ounces. So if you're 200 pounds, that's 100 ounces of water. I usually say do about 100, 120 ounces, on average a day. You need the water so that it can flush a lot of the toxins out. All the stuff that you're burning, you want to flush out. And then you want your muscles to be hydrated, your skin to be hydrated. So you're just drinking lots of water. And that also helps with the gut. It also helps with getting the gut hydrated so it can start moving through it so you're not constipated or anything like that.
One of the questions we have here, John from Monterey, California, is asking, I'm doing good with my weight, but the only problem that I'm noticing is that I'm getting up in the middle of the night craving sugar. Should I be going to drink just a shake, like a protein shake? Or, of course, he wants to focus on getting some Little Debbie's over at Walmart. So he's having a struggle with that.
I would say the best thing to do is book a consultation with us so we can kind of dig in and see why. Like, are you not eating a certain time, so then you're waking up starving? Because that's not a normal thing for most people. So there's lots of questions that I have in order to get that kind of answered, because that's not a normal behavior to do. But I mean, it could be hormones are off. It could be that you're eating, too early. Like I had someone that was like, "Hey, I eat my dinner at 4 o'clock because I heard that eating right before bed isn't good. That's a yes, no, kind of solution there. Like, yeah, maybe you can push it to 5:30, so you're not waking up early or waking up in the middle of the night starving. Or, we get it with like bodybuilders. Like I get it all the time. Like bodybuilders have to have a certain amount of protein and calories a day. And sometimes, yeah, you have to wake up in the middle of the night and have protein or, have your meal because you're building that muscle. So again, there's so many questions in order to answer that.
All right. So the next question today, which is still regarding weight loss, is going to be talking about the GLP, the one medications. Dr. Mo, if you can kind of go a little bit deeper into that.
Yeah, I
So,
mean, GLP-1s are huge talk, and that's among everybody. I mean, you saw it in the Emmys and Grammys and all that. A lot of talk about it as well, and how a lot of actors and actresses are on it or have used it. But yeah, I mean, there's semaglutide or tirzepatide. The other ones for it is whether Ozempic or Manjaro. Those are the same things. Semaglutide and tirzepatide are just a generic, but they both mimic natural hormones. They help regulate blood sugar and appetite. Kind of like, if you have a huge appetite, that could be something that you do to decrease appetite. And that's kind of like, I think it was John earlier that asked the question about waking up in the middle of the night. Well, it could be, hey, let's put you on one of these so you're not as hungry. It also slows the gastric emptying, reduces hunger, improves the insulin sensitivity. So there's lots of things are coming out also in the research showing that there's lots of benefits with other things like heart and different and brain health and stuff like that. But often patients, when they do that, they actually feel full faster and they make better food choices without the effort, really.
the next question is from Millie. She says, what makes your program different than getting this from like a med spa?
That was a great question. I mean, every prescription that is done, it's doctor supervised. Again, we're digging in deep in the consult first to see what is your goals, what is it that you're trying to accomplish in for your health. And then that's how we can then say, well, yeah, this is a great product for you, or no, that's not. Maybe it's gut health. And I get that all the time because we do advertise for tirzepatide and semaglutide all the time, but we'll get patient in and I'll be like, well, if you want a long term and, then it's not GLP-1, it's gut health because that's the issue that you're having. You've tried all these diets. So it really all depends on what your goals are and then are you a candidate for it or not. But we're not just handing you a shot either. We're showing you how things are done. You're coming in every 2 weeks, so we're doing weight and measurements. So we're kind of, supervising it throughout and not just giving you the shots and all right, see ya, come back when the shots are done. So we customized the plan around your labs, your hormones, your gut health, your lifestyle. That's why our patients are keeping the weight off.
Awesome. We have Walter from Iowa asking, what's the difference between, if I could say this correctly, semaglutide and I can't say this. Bro,
Semaglutide and
bro,
tirzepatide.
bro, what the hell? Some transformer looking semaglutide.
Mouthful, huh?
Bro, wait, I don't understand why I can't say it. Tersupatide? Tersupatide?
Tirzepatide. Tirzepatide.
Tersupatide. Okay, and semaglutide?
Semaglutide.
Okay,
Semaglutide.
okay, okay. Here we go. We'll try it again. All right, we have Walter here from Iowa asking, what's the difference between semaglutide and tersupatide?
There you go. Well, just think of semaglutide as like the first generation, tirzepatide is second generation. But really, what tirzepatide targets is two hormone pathways. It's the GLP-1 and GIP. So usually that's the one that works faster. And, it's really all, again, depends on the patient. Some patients respond better with the semaglutide. Some patients respond better with the tirzepatide. And we can, start with one. If one isn't working as well, then we can switch to the other one. But we help you choose based on the metabolism and your goals.
Sounds awesome. So right now we're going to be discussing with Dr. Mo on the gut health optimization. If we can talk a little bit about that, and also why is gut health so important for weight loss?
Well, like I said, your gut is your second brain. I mean, that's where 80% of diseases come from. That's where inflammation comes from. I mean, the gut controls digestion, mood, immune system, even your cravings. And if your gut is inflamed or out of balance, that's where weight loss becomes sluggish. So no matter how well you eat, because I'll get people that go, I eat really well, or I barely eat one time a day or two times a day. That's not really, if your gut flora is out of whack, that's never going to do anything for it. And that's why you're not losing weight. And that's why you're not seeing a difference with what you're doing.
We have another question from Helen, and she says, do you test for gut problems? Yes, we did hear you talk about that, but she wants to know a little bit more in depth about that.
Yeah, I mean, we do a lot of gut testing. Again, that depends on the person, and if they want to go really deep into the testing, we can do like functional testing to identify like food sensitivities. I actually did that just recently just because I wanted to know. I usually tell people, and that's why I've kind of held it off for so long, is you'll find things on there that you're eating every day, and if you want to do it, you're gonna follow what the testing says. And I'll give you an example. Like for me, it said black pepper, and I love black pepper on my stuff, like salad and stuff like that. So that was a real bummer. Or cinnamon was another big one. I use cinnamon basically every day, and I'm like, well, these are all foods or spices that I like, but I'm sensitive to it. So I should cut that back so I'm not irritating my gut flora. But yeah, you could do food sensitivities, test for leaky gut, inflammation, even certain bacterias to test the flora. But that's how we can create specific protocols or specific supplements or probiotics for you based on your testing.
Awesome. And so I know that as we're continuing speaking on weight loss, we're looking at red light therapy and infrared sauna. If we can kind of discuss a little bit the in-depths of that, one of the questions that we have on that right now is Bill from Kentucky saying, what's the benefit of red light therapy in your program?
Red light, yes, we do have a lot of red light and infrared sauna in a lot of our programs. I mean, red light therapy, that stimulates your mitochondria. That's the powerhouse of your cells. So to improve fat metabolism, it's also used for reducing inflammation, tightening skin, even supporting thyroid. So it's painless. It usually takes anywhere from 15, 30 minutes. The one that we have, we actually do full body. So it's face, you could do your full gut area, your arms and your thighs, legs. So it kind of gets everything, and patients love it. I mean, you just lay under there and take a nap while getting the benefits.
Sounds great. So the other question that we have, I don't have a name here, but it says, how does the infrared sauna really help? I know a lot of doctors talk about this, but I do not know much about it and cannot find much information on the internet about it.
Yeah, so infrared sauna, there's a lot of hype on that now. We also use it because there are lots of benefits. It helps detox your body at cell level. It reduces stress, lowers inflammation, boosts circulation. Also, a lot of times it'll improve sleep. We use it a lot with people that work out at the gym because our location is located by a gym, so we'll get a lot of people after a workout. They'll go and sit in the infrared sauna, and what they find is they're not as sore the next day. Muscle recovery also helps amplify the weight loss and accelerate the recovery, like I said.
Awesome. So the next thing we're going to be talking about within weight loss is hormone therapy. Why do hormones matter in weight loss?
Well, like I said, the hormones are your gatekeepers to metabolism. So if your thyroid is sluggish or your cortisol is too high, your body won't burn fat efficiently. And that goes with the other hormones that we test, like for females will be progesterone. Females and males will be testing testosterone and estrogen. And from research shows that females, once they hit 20s, that's where hormones starts to decrease. Males in their 30s is where hormones will start to decrease. By the time you're over 35, both male and female should get these tested because as you age, your hormones decrease. And that's where, you hear a lot as someone ages, like bone density decreases or Alzheimer's or dementia. These are all associated with decrease in hormone levels.
Awesome. We have Aisha from Brooklyn asking, she said, she know you talked a little bit about hormones, but what are some of the effects that you're seeing currently in hormones? Because she says she knows for a fact that her hormones are off. What are some of the hormone panels that you use or modalities?
Hormones, we have to do the lab first to see really what's going on internally. So that's a full panel that we're doing. That's also testing your storage hormones and your free active hormones. Not a lot of people test for those. So we want to know what's really in your body before we add anything to it. So that's, like I said, we're testing testosterone, estrogen, progesterone, thyroid, B vitamins, D vitamins, just regular blood panel, lots of different things in order to determine really what's going on. Because it could be hormones are fine, but your D vitamin is low and that's why you're feeling sluggish. So we got to increase that. So it really all depends on the person again. And that's why everything is customized to the person. And then we can have customized supplements for them, or we could do customized bioidentical hormone therapy. So really, again, it just depends on the person.
Awesome. So another question we have, because there's some people that have been following you and of course Iowa Wellness Center's program. They want to know what makes Iowa Wellness Center's program so unique compared to others that you've seen.
Like I said, everything we do is customized. It's not a cookie cutter plan. You can send 10 people in. It's not all 10 people are not going to get the exact same product. Again, we have to talk with you, see what your personal goals are, health goals. And then from there, and based on your history, it could be your medications, your everything. We're digging deep. And then that's how we can determine what's the best approach or program for you that we could do. And it's not guessing like, yeah, I'm just going to give you this and we'll test it out. No, we're actually digging deep and trying to figure out the core problem for every patient. And that's by doing the consult, the labs, the one-on-one doctor supervision. We treat you, not the symptom.
Awesome. The next question is from John. Do you offer in-person and virtual consults?
For sure, we do. Yes. I work with a lot of local patients in Iowa. My average drive that comes and sees me is about 2 hours. My furthest drive right now is 8 hours.
Wow.
But yeah, I've done virtual. We do have patients down in Florida, Arizona, Texas. I do have a few now from New York and a few from California. So yes, I do virtual.
Sounds great. Thank you so much, doctor. Now this is where we would do the outro for the sales pitch that we're going to
Okay. If you've been listening and saying, that's me, I've tried everything and nothing's working, I want you to know you haven't failed. The system has failed you. Our system is different because it's built around you. And today, like I said earlier, I'm offering you the chance to start risk-free. For the first 12 listeners who call or go to our site, I'm giving away a free doctor consultation. It's usually a value of $350. Review your history, your health, your labs, goals, and map out a customized plan together. So let's find out what's holding you back and fix it. Call the number that's on the screen or visit the show, and you can follow us on Instagram, Facebook. You can see behind the scenes stories, before and afters, and motivation to fuel your wellness journey. This has been the Healing Wellness Show. I'm Dr. Karim, and until next time, stay strong, stay curious, and stay healing.